edition of the National Emergency Operations Center COVID-19 Weekly Briefing for Wednesday, the 6th of October, 2021. I am Lesroy Williams. Thank you very much for joining us for our briefing today. I recognize among us the Honorable Wendy Phipps, who is the co-chair of the Disaster Mitigation Council, and I also recognize the Minister of Health, the Honorable Keela Byron Nisbet. I also recognize, I haven't seen her for quite a while, Mrs. Christmas Jacobs. Happy to have you back, Mrs. Christmas Jacobs. She provides a very vital service here at these press briefings. We continue to update you on the management of the pandemic here in the Federation of St. Kitts and Nevis. You have not been seeing Dr. Laws for some time. Dr. Laws is on a well-earned vacation until the 20th of this month, but she still remains very much in touch with the team virtually. During her absence, the longest-serving doctor within the Ministry of Health, a service spanning some 24 years, is the acting CMO. That is Dr. Cameron Wilkinson. Dr. Wilkinson has worked on the 2 different administrations and on the 5 health ministers and acted as CMO on many occasions. The government is doing its utmost best in the management of the pandemic, but we all have a part to play in taking personal responsibility for our actions in getting vaccinated and adhering to the non-pharmaceutical measures, and we know what they are. There has been an extensive education campaign by the Ministry of Health, and the platform here at these NEOC COVID-19 briefings. The National COVID-19 Task Force has been meeting for over 18 months. At one time, we met every day. Now we are meeting once a week, and sometimes more than once a week, as needs be. We work hard in the management of the public health crisis that has not only affected us here in the Federation, but it has affected the entire world. We continue to work despite some who abuse us on social media. There are challenges, but we can help to reduce those challenges on the health sector if each person will do his or her part to help cut down on the transmission of the virus by following the health measures. The pandemic is not over, and we must bear that in mind. I now call to the podium Superintendent Cromwell Henry, who will give us an update on the regulations. Superintendent.
Thank you, Mr. Williams, and a pleasant good afternoon to all listening to this broadcast via whatever means. Following an investigation into a report of breach of quarantine at a government-approved COVID-19 hotel on St. Kitts, police have arrested and formally charged DeAndre Brown of New Road and Kishnell Romney of Parsons. Brown was charged on 3 counts of breach of his quarantine conditions, while Romney was charged for visiting a quarantine site. Additional charges with respect to breach of the night curfew are expected against both individuals. The circumstances of this breach are that between September 8th and 9th, while Brown was in quarantine at the hotel, as an incoming traveler, he was visited by Romney, who left the hotel compound with Brown. This was captured on the hotel surveillance system and brought to the attention of the police. Regulation 14.6 of the Emergency Powers Regulation states, all arriving travelers who are fully vaccinated shall remain in a government-approved COVID-19 hotel or quarantine facility for a period of 4 days. And subsection C states, such persons shall only be released from quarantine upon receiving a negative RT-PCR test. Regulation 12 states, no person shall visit or be permitted to visit a person who is in quarantine or isolation. I wish to reiterate at this point the importance of remaining in quarantine when you are required to do so, whether it is through travel or through contact tracing, even if your test results are delayed. The regulation is clear, and the regulation is clear. A person shall only be released from quarantine upon receiving a negative RT-PCR test. Any person who contravenes or fails to comply with these regulations shall be liable on summary conviction to a fine not exceeding $5,000 or to a term of imprisonment not exceeding 6 months, or both. I will close by making my usual appeal for persons to follow the COVID-19 prevention protocols. That is, wear a mask when you are in public, practice good hygiene behavior, avoid crowds and crowded places, and more importantly, get vaccinated. Thank you.
I now want to invite thank you very much, Superintendent Henry. I now want to invite Dr. Cameron Wilkinson, the Medical Chief of Staff at the JNF General Hospital and Acting CMO, to address us.
Thank you very much, Lesroy. And I know that the CMO, Dr. Hazel Laws, is looking right now. I just want to wish her a pleasant and restful and well-deserved vacation. We continue to update you on a daily basis with the situation report, and we're happy to come here on a weekly basis to inform you as to what's happening. Recently, there were a lot of complaints, rightfully so, about the backlog that we were experiencing. And this was because our testing system was overwhelmed. We have spoken on many occasions about protecting the health system and making sure that we don't overwhelm the health system. We saw around the world, in the UK, North America, and Europe, when they had a significant increase in their waves, that the healthcare system became overwhelmed, such that they had increasing number of hospitalizations, deaths, and there were persons who were waiting for hospital beds and could not get a hospital bed. We were happy that while we were going through our wave and continue to go through our wave, we have not gotten to that point, and it was just our testing system that was challenged. We apologize to the persons who were inconvenienced because of this. We know that there were some persons who were kept in quarantine or isolation for an extended period of time, and we apologize deeply. We, however, addressed the backlog by outsourcing some of the testing. And we also, during the period, attempted to increase our laboratory testing capacity. I'm happy to report that we now have 4 labs in the Federation of St. Kitts and Nevis that are doing RT-PCR testing. The Joseph and France Hospital is back on board with a capacity of 120 to 140 per day. The Next Generation Lab, a capacity of 150 to 300. And Avalon, the capacity has increased since the last time I made the presentation to 150 to 200. And Quality Diagnostics, they're currently at 8 to 12, but very soon they'll be getting some additional machines. And we expect to hear great news over the next week or two about increased capacity at the quality diagnostic laboratory. The samples, as I said, were sent overseas to address the backlog. We need to change the slide. To address the backlog. And the backlog was mainly from samples collected between September 21st to September 30th. There were 1,174 tests that were sent overseas for testing, and the results came back. We had 112 of those samples that were reported as positive, and 1,062 were reported as negative. We were able to report 145 recoveries during this period, and to date, 358 from that backlog of persons were released from quarantine. And so we're happy that persons who were desperately waiting to be released, that they were released. And this information will be reflected in the situation report of the 5th, which should be circulated just about now. But just to give you the information that would be seen on that situation report, as of Tuesday, the 5th of October 2021, we added 61 new cases. So the total confirmed cases in the Federation of St. Kitts and Nevis would go to 2,246. 380 of these are in Nevis and 1,866 in St. Kitts. There are currently 1,073 active cases, 107 in St. Kitts, in Nevis, and 966 in St. Kitts. The number of cases recovered is 1,157, 271 of these in Nevis, and 886 in St. Kitts. We have a total of 23 hospitalizations between St. Kitts and Nevis. 4 are in Nevis, 19 are in St. Kitts. There are currently no patients on the ventilator. However, of the 19 that are in St. Kitts, 3 are very ill. And again, we continue to make the appeal to persons to get vaccinated, because that is your best chance of decreasing your risk of being hospitalized. The Federation has a total of 16 deaths related to COVID-19 thus far. Can we get the next slide? This slide shows you the 2 waves that we have recently gone through. The first part of the graph shows you the peaks and where the troughs came back down, and the second part of the graph is showing you the current wave that we are going through. We appear to have peaked in the center and was coming down. However, we had an increased number of cases reported over the last 24 hours, which was 61. I do hope, though, that we continue to see the general downward trend. The number of cases that we've been seeing based on the age group, it continued to affect mainly the young persons. We see that we need to change the slide. We see that the majority of persons who are currently being infected are young persons between the age of 20 to 29. That represents 17.3%. But most persons are between the age of 20 and 40. And these are the persons who are up and about, moving around, etc. And so we encourage you, when you're out, to make sure that you continue to adopt the non-pharmaceutical measures, because the virus cannot move from point A to point B without you moving. And so if you're going to move, you need to make sure that you move in a safe way. As it relates to the deaths that I spoke about, we said that we had a total of 16 deaths. 14 were in St. Kitts, 2 in Nevis. And of these 16 deaths, only 2 were fully vaccinated. So the majority of deaths are in the unvaccinated. And these persons, the majority of them had comorbidities. In other words, these are persons who would have had diabetes, high blood pressure, maybe asthma, renal disease, etc. And there is a misconception out there that if you have an underlying condition, you are not strong enough to take the vaccine. That is totally and completely incorrect. The ones who really should be coming forward to get vaccinated are those persons with comorbidities, with preconditions, with diabetes, with hypertension, with heart disease, with kidney disease, with asthma. Because if you got COVID-19 compounded with your pre-existing conditions, the chance of your survival is significantly decreased. And it is sad to say that the number of deaths will continue to rise unless people do what they need to do to protect themselves, which is continue with the non-pharmaceuticals, but more importantly, getting vaccinated, which offers you the best protection. As it relates to the ages, we had 1 between the age of 30 and 39, 5 between the ages of 40 and 59, and 10 over the age of 60. And so you can see that no age group really is immune, and we need to make sure that we do all we can to protect ourselves. As it relates to the number of cases and their vaccination status, the virus again continues to find the persons who are unvaccinated or partially vaccinated. Because of all the cases that we've had so far, only 17.3% has been in the fully vaccinated. I am happy that our vaccination program continues to be a success. And as of yesterday, the total percentage of adults who were fully vaccinated was 68.6%, and the adults with 1 shot was 76.3%. And so this is significant as we march forward towards reaching a goal of 80% adults fully vaccinated. Our 12 to 17-year-olds, they are coming forward also, and as of yesterday, we had 3.7% who were fully vaccinated and 9.1% with 1 shot. We can see that persons are coming forward to accept the Pfizer-BioNTech vaccine, and we have a total of 1,367 persons, adults and children, who have received 1 shot, and a total of 876 who are now fully vaccinated with the Pfizer vaccine. Again, we said that there is no barrier to vaccination in the Federation of St. Kitts and Nevis. You do not need to call to make an appointment. Just today, I had to make this point again to about 4 or 5 persons who told me that they thought they had to call the clinic to make an appointment. You do not need to make an appointment. You just show up during the hours that are designated for vaccination, and you will be vaccinated. So again, I encourage everyone who can be vaccinated to go out and get vaccinated, as this is your best chance at survival. I think it's important for one to try and get the digital version of the card so that you can always have it with your technological device, whether it's your cell phone, your iPad, etc. And it's very easy for you to get your digital version of the card. You simply need to visit the Ministry of Health at the Bladens Commercial Complex. When you go there, you will bring a government-issued ID along with your immunization card, okay, for validation. You will be provided with an HID number, which is a health identifier number, and so everyone who would have been vaccinated, you would have had a 7-digit number, and it's on your card. You don't have to try to memorize it. You will then be directed to the website, myvaccinerecord.gov.kn, and when you click on that website, you will see, as you see on the right side of the screen, a box where it will ask for your name and your date of birth and your HID number. Once you click retrieve your record, you will see, next slide please, you will see your vaccination card that will come up, and this is my vaccination card, and as someone who is a public figure, health professional, I have no problems in sharing the fact that my status, that I'm vaccinated, and I believe everyone who can should. Let's move on. Now, we have plans to take the vaccination program into the schools. Just yesterday, there was a virtual meeting between members of the Ministry of Health and executives in the Ministry of Education. Present in that meeting, we had all heads and deputy heads of the primary and secondary schools and persons from the Early Childhood Development Program, where we spoke about the vaccines and the plans to educate our parents and teenagers about the vaccination. We would be having a number of virtual PTA meetings with the parents and guardians who need more information about the vaccine. I can tell you that the first one is scheduled for tomorrow evening at 6:30. We'll be speaking with a number of the schools virtually and answering questions from the parents. And within the following week, we should be scheduling sessions where the teenagers can come in with their parents or guardians to be vaccinated. However, one doesn't have to wait for these PTA sessions because there are a number of adults who have done the research themselves, they have made up their minds, and they know that the vaccines are safe and effective, and they have been bringing in their teenagers to be vaccinated, and we want to encourage you to do that. So you don't need to wait until we come to your school or your class. You can bring your teenager in to get them vaccinated. As it relates to our contact tracing protocols, there are a number of questions that are being asked, and so we have two categories of contacts. You can be fully vaccinated or unvaccinated. For the fully vaccinated contact, you are, of course, encouraged to continue the use of the non-pharmaceutical measures to protect yourself and to protect those who are around you, because that offers you significant protection. You will continue your work or usual activity and will not be placed in quarantine. And so just because someone named you as a contact, if you're fully vaccinated, you will continue to do your usual activities. You will receive one RT-PCR test 7 days post the last time you were exposed to that contact, but it doesn't mean that you'll be home for these 7 days. You will be at the workplace or doing your normal activity. If that test is negative, then you will be cleared from monitoring by the Ministry of Health. If it is positive, of course, then you will go into isolation and you'll be monitored until you're recovered. If the fully vaccinated contact is living with a positive case, the situation still applies. However, the Ministry of Health will do some investigations to see whether or not that person could safely live in the household with the positive contact. If that is not so, then a decision will be made whether or not it is safer to move the positive case out of the house or move the person who is vaccinated out of the house so that there is no risk of spread. As it relates to the unvaccinated or partially vaccinated contact, this is more straightforward. That person will be placed into quarantine for 14 days, and they will be tested at the end of the 14 days. And if they are negative, then they would be released from quarantine. And so for the unvaccinated person who is named as a as a contact, they will only receive one test. That is at the end of the 14 days. Now, what is the risk of the importation of the virus based on our entry protocols? Now, just to summarize briefly, our protocol requires that only vaccinated visitors come with a negative PCR test that is done within 72 hours of travel, and they're kept in quarantine for 4 days and then released if they test negative. Children we know who are unvaccinated or cannot be vaccinated, they move under the umbrella of their parents or guardians. Citizens and residents, they are not prevented from coming back home depending on their vaccination status. However, if they are unvaccinated, they will have to be quarantined for 14 days and receive a negative test prior to release. When we looked at the data for the last month, from September 1st to September 30th, we found that of the 844 positive tests that were returned, 11 of the 844, or 1.3%, were from the inbound passenger, and 833 of the 844, or 98.7%, were from persons in the community. And this tells us that the risk from the inbound passenger is low, and there is therefore more latitude for us to further reduce the quarantine period as the incoming passenger does not offer a significant risk. And so next slide, please. And so we'll wait to see whether or not there is any further reduction in the quarantine period. I know that there are some persons who would be anxious to come home to be with their family and friends for the Christmas season, and they would not want to go and make a booking knowing that they might be locked up for 3 or 4 or 5 days, knowing that they might come on Christmas Eve and not be out for Christmas Day. And we're taking all those things into consideration as we balance lives and livelihood and attempt to make you safe and keep you safe. And so we wait to see what are the new orders as it relates to the vaccination status. This just simply demonstrates graphically what I just said. Again, you can see there was only 1.3% of that 844 from the inbound passenger, and 98.7% were cases from in the community. Next slide. Now, I'm going to use the education corner to tell you briefly about the antigen test. The World Health Organization recommends that all suspected cases be tested for SARS-CoV-2 or COVID-19. And the gold standard, as we've said many times before, is the RT-PCR test. But the antigen detection and rapid diagnostic test is finding greater use in the management of SARS-CoV-2. Next slide. So these antigen test kits, they detect viral proteins. The sample is taken from the nose or the throat, just like the sampling for the RT-PCR test. And these tests are cheaper than the PCR test and will offer results more quickly, although they are generally less accurate. These tests perform best when there is more viral circulating in the community, and when samples are taken from individuals during the time when they're most infectious. And what we want to do is to use a rapid antigen test that has a fairly high sensitivity and specificity. And so any test that is being recommended by the World Health Organization should have a sensitivity of greater than 80% and a specificity of greater than 97%. Okay, and this is compared to the RT-PCR test, and we know that the antigen test does not require any significant laboratory infrastructure, so it's easy to perform. Now, questions will be asked then: how, when, and where would these tests be performed? And speaking in general, giving you information as to what's the recommendation by the World Health Organization. According to the WHO, the rapid antigen tests are used to detect acute SARS-CoV-2 infection and are best used for, and there are 4 settings that they can be used for. A, in case finding as a primary case detection tool for testing suspected cases of COVID-19. And they can best be used in many settings, for example, in healthcare facilities, in testing centers, in care homes, in prisons, in schools and communities, etc. And more they're finding a role in these settings. They also can be used for contact tracing among the asymptomatic contact cases, where you can get your results quite rapidly. We need to move along. They can also be used to investigate outbreaks. For example, if there was an outbreak in a nursing facility, in a school, in a prison, on a cruise ship, in the workplace, or in dormitories. And so they're finding more and more use in these settings. They can also be used to monitor trends in disease incidence in communities, and particularly among frequently exposed workers, including healthcare workers, irrespective of the symptoms. It's important to note that the rapid antigen test to be considered, or if they're going to be considered, will be done in collaboration with the RT-PCR test, which is the gold standard. And any test that would be considered would be approved by the World Health Organization or the FDA. And there's a long list of these tests that could be found on the WHO site, and I'm pretty certain that our local labs are looking at these sites to position themselves as the science evolves and they become more in use. I want to end by speaking just briefly again to the persons who are affected by SARS-CoV-2. We know that there are only 20 plus persons in hospital, but there are a number of persons who are outside at home fighting the disease. I want to encourage you to stay in contact with your case manager. You also need to stay in virtual contact with family and friends, because being locked up at home, it can have significant psychological deleterious effects on you. I know just being quarantined for 4 days when I traveled and came back, it was distressing. And so for persons who are there for 14 days, 20 days, 21 days, it can be distressing. I want to point out too, though, that sometimes we might hear of someone who is complaining that they have been in quarantine for 21 days or a month. And sometimes it's important for you to get the real facts. It's not necessarily that those persons are being kept for 21 or 30 days because of any backlog. You might have, for example, an adult who might go into quarantine or isolation because they tested positive. And on day 14, when they are ready to be released, they might have a child who tests positive, and that child cannot isolate by themselves. And so they would have to make a decision to remain in quarantine with that child or family member. And so they would be absorbing the risk associated with that child. And so their quarantine period can be extended to a further 14 days. And so it is perceivable how someone can be in quarantine for 28 days, not because of any delay from the Ministry of Health, but because they had to absorb the risk of a family member who could not be quarantined by themselves. And so we need to make sure that we continue to offer as much support to these persons when they are in confinement for such a long time. We want to encourage you to boost your immune system by trying to eat healthy, maintain your hydration, to get adequate rest, and to continue to exercise and to take your vitamins and supplements. Most importantly, however, we want to encourage you to take the best tool that can protect you from severe disease, hospitalization, and death, and that is the vaccine, while you continue to wear your face mask at all times, especially when you're in public, and to continue with the hand hygiene and maintaining adequate distance from persons when you're out in public. And if you're ill, it's important for you to stay home so that you don't continue to spread the virus. What I want everybody to understand that we are all in this fight together. And when we see the numbers rise, these numbers are not the Ministry of Health numbers. These are the numbers for the Federation of St. Kitts and Nevis, and we are all affected. And we can do all that we can also to make these numbers come down. And so the reaction should not be to finger point and point blame. This is one time in history where the singular action of an individual can affect all of us collectively. And so whether you are large or small, rich or poor, black or white, old or young, your action can affect the entire nation. So I want everyone to try and stay safe and abide by the non-pharmaceuticals. And if you can be vaccinated, go out and get vaccinated. I thank you.
Thank you very much, Acting CMO, Dr. Cameron Wilkinson. Before I introduce Mr. Samuel, I want to make an announcement that people in Africa are rejoicing at the historic announcement that children across much of the continent are to be vaccinated against malaria. Malaria kills close to 500,000 people a year in Africa, two-thirds of them African children. And the World Health Organization has approved a vaccine for malaria just today. And that is a big announcement. So vaccines are nothing that are new. Vaccines actually saves lives. The people in Africa are rejoicing. They are rejoicing because they know that so many children each year die from malaria. And now they have something to save the lives of children in Africa. Mr. Samuel, I now invite you. Mr. Samuel is our chair of the National COVID-19 Task Force and the National Disaster Coordinator at NEMA.
Good afternoon, and thank you, Mr. Williams. And you know, oftentimes you stand here before everyone and you thank everyone, and you leave out yourself. So I think my other colleagues here will join me in saying thank you to you too for the work that you are doing in keeping the general public informed. Good afternoon, everyone who is watching via all various means. Thank you for joining us again on another New York briefing. Today, October the 6th, I wish to bring a number of activities to your attention. First, I want to start off by informing you how we have done things with the risk communication. You realize that once a decision has been taken, or if we are planning to take a decision, if we advise on a decision or a recommendation, we like to tell you earlier on. So we have been telling you about the restriction that was lifted in the UK, and also the return of the BA flight to St. Kitts, because we have had a lot of citizens who would have been calling with their interest in coming home, but they did not want to go through the United States or go to Antigua. So they were rather excited when they heard the news. So I am pleased to announce to you that the BA would have arrived on Sunday, the 3rd of October, with a total of 82 inbound passengers from the UK. I'm rather pleased to see the BA again. As a matter of fact, I would have seen a number of posts on social media where persons were welcoming the big bird back to the Federation of St. Kitts and Nevis. I think for us is a sign of our economic recovery going forward. So again, I want to thank all who would have played a significant role in ensuring that BA returns to St. Kitts and Nevis. Yesterday, October the 5th, we would have experienced our second port of call by the Celebrity Equinox. So the Celebrity Equinox would have made another port of call to the Port Zante and St. Kitts with a total of 1,376 passengers. So I think it's significant. It's an increase from the last port of call they would have made to St. Kitts. We are hopeful that this can continue, and from all indications from Tourism Authority is that we are hopeful that in November the numbers of cruise ships making ports of calls to St. Kitts will increase. Sorry, should increase. Also, I wish to inform you of some of the engagements we would have had for the past week. For example, the National COVID-19 Task Force would have met with the hoteliers on St. Kitts and Nevis to discuss a number of matters that is affecting their service and their business. And one of the areas that would have been highlighted is the reduction of the quarantine period. And I must inform you that several recommendations are before the members of the cabinet at this time for us to have the quarantine period reduced. There are recommendations of 48 hours and test, 24 hours and testing. We will await the decision of the federal cabinet to advise the next regulations, hopefully. The Ministry of Health also would have agreed, represented by the acting CMO, Dr. Wilkinson and others, and the HEOC. I think that's what we were notified at the task force level, that indeed we will also assist the hoteliers by allowing the hoteliers to be able to contract the services of the labs and having certified doctors and nurses conduct the swabbing of their guests. This, we project, would help us with the current challenges as well as easing the burden on our public health officers who are working extremely hard. And at this time, I really want to stop right now and commend Mr. Joseph Markman, who is doing a tremendous job in managing the contact tracing activities that are happening in St. Kitts and Nevis. When someone can accept a call at 2, 3 o'clock in the morning, and by 7 o'clock in the morning is up already, you call that true commitment to national service. So to you, Mr. Markman, we say, we express our gratitude. In our discussions with the hoteliers, we also discuss the departure test. So as it is right now, for you to depart the Federation, depending on the destination you're going to, most destinations are requiring tests. Various destinations have varying requirements. For example, some destinations would accept the rapid test, antigen test, PCR tests, etc. So we have been in discussions with the hoteliers, and Dr. Wilkinson would have begun his discussion with the various labs, because eventually, in order to have an easement and also to enhance the experience of our guests and our tourism product, we are of the view that persons who will be departing the Federation should be able to undergo a rapid test or antigen test based on the destination and the acceptance of the destination going forward. So I think that is some welcoming news for the hoteliers. So rather than having to do a PCR test to depart the Federation of St. Kitts and Nevis, you should be able to now do a rapid test, antigen test, etc. So these are some of the recommendations that we accepted and we have agreed upon. That's the National COVID-19 Task Force in collaboration with the Ministry of Health, and also supported by the cabinet members. However, as Dr. Wilkinson said, what we are hoping to do is to have the WHO-approved tests administered. I would have reported some time back that we would have received a 40-foot container with food, and we have been distributing the food to critical departments, agencies, and partners here in St. Kitts. As of today, we would have distributed food to the HMP, Her Majesty's Prison, New Horizon, the Saddler's Home, and the Defense Force. Tomorrow, the distribution will continue, with food being distributed to the Cardim Home, Children's Home, the JNF Hospital, and school meals. And then a significant portion of that food will also be utilized for persons who go into quarantine and isolation, who need either items to cook or they need a hot meal. So hot meals are still being provided by social services. And we have to commend social services, because quietly behind the scenes they have been working hard, being led by the director, Ms. Oslin Ward Harris, and the hard-working team of females, in particular, mainly females, and you see them lifting boxes and doing what they have to do, just like men, and we have to commend them. I have some exciting news on behalf of NEMO, where we will be celebrating the International Day for Disaster Risk Reduction, and for short, we call it the IDDR Week. So what's the IDDR Week? It's a week of activity where we commemorate the International Day for Disaster Risk Reduction. What are the activities for that week from NEMO? Well, it will start on Friday, the 8th of October, with the launch of the NEMO, the Finding Nemo. So we're going to have a virtual scavenger hunt, Finding Nemo. Not Nemo, the fish, Nemo, the agency. So you will find Nemo, and if you do a good job in finding Nemo, I think you will have some prizes. I think first prize will be a tarpaulin, first aid kit, a cooler, and some face masks. The second prize would be a tarpaulin, flashlight, and some face masks. And the third prize will be a flashlight and face mask. So let's try, please find Nemo. Not come here, go online. Okay? On Monday the 11th, we will have a Thanksgiving service virtually, so please log on. And also let's thank God for a peaceful 2021 Atlantic hurricane season that we have had so far. I hope I'm not talking ahead of time, because the hurricane season has not ended. On Wednesday, the 13th of October, we will have the International Day, the IDDR speech, which will be done by the co-chair of the Mitigation Council, the Honorable Wendy Phipps. And Thursday the 14th, we will have the NEMA staff video in conjunction with the NDMD, I hope. And we will, on Friday the 15th, we will have a staff retreat. We are hoping to swim with the dolphins. We are hoping to do some things in nature. I don't know. Hopefully, Ms. Southwell will come in her bathing suit and take us to the beach. All right, so we are hopeful that we will have a week of activity of excitement. Please join us virtually and otherwise. At present, the Hurricane Alley, the Atlantic, is quiet. There is one disturbance with a 10% chance. However, it is not expected to cause any significant challenges, harm, or threat to our region. So we have to thank God because we have had some significant threat and risk to the Caribbean region, but we have been spared. So now for the hurricane season, we only have one remaining named storm, and that's Wanda. We are hoping that Wanda will come and Wanda will go, and we will have a very impact-free, risk-free 2021 hurricane season. I want to end by sharing an experience with you. And I have a good friend of mine who, as they watch the occurrences of persons dying from the as a COVID-19 related death, the person was moved and convinced that it is time to accept the vaccine. Again, yes, it's something that you have to do on your own. It's your own will, it's your own choice. But take a good look at what is happening around us. No, the government has not thrown up the hands. No, we have not lost control of anything. And Dr. Wilkinson would have outlined a strategy that was undertaken to mitigate the issue of the delayed test results. We would have looked at Superintendent Henry would have outlined what would have happened to persons who break the regulations. And we have seen, so we have been working, enforcement is happening. The reality is, ladies and gentlemen, I don't think everybody should get a $150 ticket just so. It's important that we continue to educate, and if we speak to you once, then the second time is about giving you the ticket. There are persons who express concern to me that we are not enforcing enough, we are not giving sufficient tickets. Superintendent Henry should come here every day and say how much thousands of tickets have been issued. One of the things I'm not hearing, though, is the personal responsibility that citizens and residents should exercise. Wear your mask. Wear your mask. If you wear your mask, if you exercise by using the non-pharmaceutical measures, and if you do the necessary thing to boost your immune system, as well as accepting the vaccine as well, then we can get out of this pandemic. We are now moving to the endemic. We are going to continue to advise you as to some of the recommendations that we will be putting before the cabinet. For example, I know the Minister of Entertainment is here, and she's eager about getting the entertainment sector up and running, and we have that as a priority to support the entertainment sector. We also have the Carnival Committee who is looking at the Carnival. But all I want to say, we have to do everything gradually so that we can move safely. Opening up, living with COVID does not mean that we have to be reckless. We have to be ever so mindful and careful of what is happening around us. But the reality is, as I was in a discussion with Minister Phibbs, is that persons have also brought the concern to me. Why is it, Mr. Samuel, that I am vaccinated and I have to come back to work as a vaccinated person, but someone who is not vaccinated goes home and sits at home for 14 days? It's some difficult questions that we have to answer. It's some difficult questions that we have to analyze and make some recommendations. How do we address that? Because we don't want to create no disparity between vaccinated or unvaccinated. But at the end of the day, we have to live with the COVID. Persons are going to get exposed. Persons are going to die. And we have to accept the fact that the only way out, and Dr. Wilkinson has become extremely famous for saying, is to vaccinate. May I humbly encourage those of you who are on the borderline of whether accepting or not accepting the vaccine to continue to do your research. Call Dr. Wilkinson. He will answer you anytime, and he will provide you with some guidance. If you need us to come and pick you up, like I told my friend, I am taking that friend of mine, myself, to get vaccinated because, I want the person to be protected against this virus. So we are going to continue to do a number of activities to make sure that we restore the country within an measured manner to a sense of normalcy again. And that is why we need your help. That is why we need the volunteerism from citizens to be able to tell another citizens, please wear your mask. The area that is given most challenges is the area of public transportation. Public transportation is where we are seeing the non-compliance with the pharmaceutical measures, in particular not wearing the mask. I have citizens who call me and tell me they just came out this bus and then persons are not wearing masks and the bus drivers will cuss them, oh, you stop me, a lady. An elderly lady said she only attempted to encourage the driver to wear his mask, and the driver responded by saying, is you stop me, what you stop me for then? So I don't think that's appropriate. It's best to just adhere to some of these concerns of our citizens and residents. So we want to encourage activities, but we have to be responsible, and it's all inclusive. Again, do your best. If you have doubts, consult the medical team, and if you need assistance, whether psychological support or whatever, please reach out. But let me take you to get your vaccination if you need be. I am willing to do so. Dr. Wilkinson, you're willing to help me? We are willing to assist everyone in getting vaccinated. Our target goal is to reach 80%. Once we reach that 80% on each side, whether it be the adults, the targeted population of adults, and the 12-year-olds and beyond, then we are hoping that we can open up in a more measured way. So that's our goal. So by December 1st, we are hoping, our projection is that by December 1st, we should have zero, hopefully, sorry, I hate to use the word, I dislike to use the word zero, but we should have no quarantine whatsoever for inbound passengers. We should be able to have a number of activities without having to worry about many other restrictions. So let's lessen the restrictions by being responsible citizens. Thank you.
Thank you very much, Mr. Samuel. I think not only people are not wearing their masks, but they are not wearing them properly and not covering their nose and their mouth, because that's the whole idea. You're coughing, if you cough, and if you sneeze, you are transmitting, particles and all of that, and the virus is transmitted that way. But I do not think that people fully understand the reason for covering the mouth and the nose. It's the coughing and the sneezing. The first question for today goes to Dr. Wilkinson. What is the risk of a vaccinated person catching and spreading the virus?
Well, I want to start off by saying that if you are vaccinated, it gives you the best protection against catching the virus, but against becoming severely ill and against being hospitalized or dying from COVID-19. I also want to mention here too that the majority of cases, they are occurring among the unvaccinated, and the majority of persons who are being hospitalized and who are dying from COVID-19 are persons who are unvaccinated. With that said, persons who are vaccinated, they can have breakthrough infections. And so it doesn't necessarily mean that is every single person who is vaccinated can have a breakthrough infection. There is a certain percentage of persons who can have breakthrough infections. However, the vaccinated person is 8 times less likely to become infected compared to the unvaccinated, and they're 25 times less likely to be hospitalized. And so we can see then that the risk of catching the virus and spreading the virus if you are vaccinated is significantly reduced. And therefore, I want to encourage everyone again to use the best tool we have to protect ourselves, and that is to get vaccinated.
Thank you, Dr. Wilkinson. This next question, I had my first dose of the Oxford AstraZeneca vaccine on August 23rd. Kindly indicate what is the earliest date on which I can return to the health center to receive my second dose. I am due to travel by October 25th.
That's why I'm going to ask you to help me by turning to your calculator. But the earliest, sorry, your calendar, the earliest time you can go for your second dose is 4 weeks after you would have received that first dose. So the person said they received their first dose when?
Yeah.
I thought you had all this information in your head.
August 23rd.
Yeah.
Is when they had their first dose? So 4 weeks from August 23rd is what?
September 23rd. It's a month.
A month, September 23rd. So just count 4 weeks on your calendar, and that's the earliest that you can return. So even if you would have been given an appointment of 8 to 12 weeks, you can go in earlier and as early as 4 weeks after your first shot.
Okay, this one is from Vaughan Radio. Persons who might have recently recovered from COVID-19 but died a few weeks after from an underlying issue. Is it safe for the public to attend their funerals?
Well, we've said before that the virus cannot move without your help. And so the person who is in the casket, they cannot move. And so even if they had viral particles on them, they cannot transmit those viral particles to you. But whether it's a funeral, a wedding, a church service that you're attending, once you are doing what needs to be done, wearing your mask properly, hand sanitizing, properly social distance, then you should be able to attend most of these activities safely.
Another one from Vaughan Radio. After the CPL tournament, by your records, have you seen a heavier influx of COVID-19 cases for the month of September?
I think I answered that question before. We started this third wave before the CPL. The wave has continued, and we have no evidence that the CPL with vaccinated patrons attending had any effect on the wave that we're experiencing. What we want to encourage persons to do is to get vaccinated. So going forward, when we're speaking about living with COVID, we can have more vaccinated persons gathering safely. And so even if there are one or two persons who, for whatever reason, either refuse or can't be vaccinated, they can be protected by the majority of persons who are vaccinated. And so if we are looking to live with COVID and have mass events again, that's the only how we'll be able to have them safely.
Thank you, Dr. Wilkinson. Dr. Wilkinson, you were asked a question last briefing about why the Federation of St. Kitts and Nevis was not on the United Kingdom's list of countries whose vaccination program was recognized. Your response was that you did not have an answer, but that you will check. Can we get an update, as the Federation is still not on the list?
I'm glad the person asked for the follow-up question, and as promised, we did the necessary research. Now, we spoke to Mr. Tom Hines, who is the head of Political and Communication Section the Department of the British High Commission in Barbados. And he confirmed that the Federation has answered all of the questions asked and provided the UK government all the data that they requested regarding our vaccination program for acceptance in the UK. He assured us that the Federation is administering 2 vaccines that are UK approved, and that the UK scientists are currently reviewing our data that was requested and submitted, along with the data from 190 other countries. And the Federation of St. Kitts and Nevis are currently awaiting approval. We are confident that in the next listing, we will be there because we successfully answered and responded to all of the questions and met all of the standards that they were looking for in a country's vaccination program.
Can the Ministries of Health and Education work together on a strategy to avoid further class school shutdowns? With most children having mild cases, it may not be necessary to shut down an entire class if one student tests positive, especially if some of these children are vaccinated or have had the virus already. It is extremely disruptive and traumatic for children to be tested repeatedly and have their classes shut down for 2 weeks.
I couldn't agree with that person more. Yes, it is extremely disruptive. Virtual learning is not for every single one. And I sympathize with the children who are going to school today, because I cannot imagine back in my day learning physics, maths, and chemistry virtually. And so we need to get our children back in the classroom. And the Ministry of Health and the Ministry of Education, yes, we are working collaboratively to try and get this happen, but we can't do this without your help. And I'm talking about you, the parents and guardians, and you, the teachers. And so I believe that every teacher has a responsibility to do the responsible thing, to try and protect the students who they are entrusted to care for. And if they want to keep the schools open, they would need to go forward and do the right thing and get vaccinated. I believe that all of our 12 to 18-year-olds who are in our secondary school system, they need to go forward and get vaccinated. And that is the only how we'll be able to keep our schools open. And also, if we continue to enforce the non-pharmaceuticals, and so if the class is not overcrowded, if students are wearing their mask and hand sanitizing, just because a case was found to be positive in a classroom, it doesn't mean going forward that that classroom would have to be closed. It doesn't mean that that school would have to be closed. And these are the messages that we communicated with the virtual meeting that we had with all of the heads and deputy heads of the primary and secondary schools and persons from the early childhood center. And I was happy to hear that there are some schools, and there is one private school, I don't want to name them for the others to get offended, but I was happy to hear that they had a near 100% vaccination rate among their teachers, and that with the students, they have them properly social distance when they're in class, and they enforce the use of the non-pharmaceuticals, wearing a mask and hand sanitizing in the classroom. And I assured that teacher that the next time there is a positive case in that school, once they consult the Ministry of Health and we do the necessary investigations, there will be no need for that school or class to be closed down. And so that is the way we are moving forward, and that is how we will be able to live with COVID-19. Mr. Abdi Samuel just said that COVID-19 is now becoming endemic, which means that it is going to be here with us for a long time, and we need to make sure that we can safely live and exist with it. We need to be able to convert COVID-19 to a disease that causes just mild disease or asymptomatic disease. And the only how you can do that is by getting vaccinated.
This one is for the superintendent. Can someone quarantine in a guest house coming from overseas, fully vaccinated?
Quarantine is only permitted at government-approved COVID-19 facilities. Other than an approved facility, you'd have to be a residence, and such residence would have to be approved prior to have to be inspected and approved for quarantine prior to the person traveling.
I think Mr. Samuel did allude to this one in his presentation, but I would ask him, with so few imported cases, how soon will you determine a relaxation in quarantine? Waiting until the Christmas season to announce changes will not allow tourists to book trips for the festive season and beyond.
Thank you, Mr. Williams, and that's a very good concern that was raised. And yes, we are cognizant of that particular challenge, and we are committed to providing information so that the hoteliers in particular, and even citizens and residents, can make futuristic plans for travel. So yes, we are hoping that by the next iterations of the regulations, we may be able to see one of the recommendations adopted, and then hopefully when we have our next engagement with the Federal Cabinet of Ministers, the Cabinet can be provided with some recommendations based on the data that we have, and then hopefully as soon as that is the recommendations are accepted, then we will be able to communicate to the general public, tourism sector, business sector, everyone, basically what will be our futuristic plans when it comes to quarantine period for inbound passengers.
Thank you, Chair. Why is it that the government will not mandate vaccinations for all public employees, as has been done in Antigua and elsewhere? Teachers, medical workers, and other workers where outbreaks have already occurred. Minister Phipps, co-chair of the Disaster Mitigation Council.
Good afternoon, everyone. Mr. Samuel, before I answer, I'm going to deliberately ask that you repeat the question.
The question is, why is it that the government will not mandate vaccinations for all public employees, as has been done in Antigua and elsewhere? Teachers, medical workers, and other workers where outbreaks have already occurred.
Okay. I thank that individual for the question, and it is a question that would have been asked and answered by this government in the penultimate press conference of the Prime Minister, the one that would have taken place in September, if I recall, early September or late August, if I recall correctly. And the fact is, for the benefit of the listeners and viewers to this program, is that St. Kitts and Nevis has the fortune of being the first and leading jurisdiction within CARICOM in terms of the vaccination rate that we are fortunate to have. We have over 70% of the target population that has already had at least one dose. And we are almost at 70% with having the target population being double dosed in terms of getting 2 doses of either the AstraZeneca and now that we have the Pfizer coming on board. It stands to reason, therefore, Lesroy, that it makes no sense to force a mandate, a vaccine mandate, on the population of a country with that type of high level of vaccinations. In all of the jurisdictions that we have noticed, including the United States of America, if I dare carry it outside of CARICOM, there have been vaccine mandates that were deemed necessary because of exceptionally high levels of vaccine hesitancy, outbreaks in the public, etc. How do we feel about vaccinations for special groups? Most definitely, the government is of the view that in the event of healthcare, in the case of healthcare workers, persons who teach other people's children, especially children below the age of 12, we would think that they will take the moral high ground and get themselves vaccinated because those children cannot protect themselves. If the day ever comes for us to reach the point of a vaccine mandate, it has to be backed by an abundance of irrefutable evidence that we had no other choice but to do so. But for the time being, there really is not a justifiable case that we can make to basically force people into taking a vaccine. A number of persons, and may I just have the liberty to add this piece, there are a number of individuals in St. Kitts and Nevis who are vaccine hesitant. And to be fair to some of them, it's not that they don't mean to take a vaccine. It could be as a result of fear. It could be other issues such as maybe they have an underlying medical condition. Perhaps they figure they don't know who to talk to. Or perhaps the persons who have been speaking to them have been speaking down to them. And what we do not want is to have people, our public, our citizens, be of the view that we are pounding them over the head to get vaccinated. I more believe that we will catch more flies with honey if we explain to persons the benefits of getting vaccine, bearing in mind that St. Kitts and Nevis has a very long history of vaccine acceptance. St. Kitts and Nevis would have been part of CAREC's vaccination program going back as early as 1978. I know this. How do I know this? Because my mother was a long-standing immunization director for St. Kitts and Nevis when it comes to vaccination. And of course, people send their children to school all the time. They get vaccines, they line up to take DPT and polio in the 70s, they line up to take pentavalent in the 2000s and so forth, and they don't question it. You yourself made a grand announcement today about the malaria vaccine. That is excellent news. Before time, if you went to an area where malaria was endemic, you had to take malaria tablets as a prophylactic and pray to God that you do not contract malaria while you're in that jurisdiction. But for the time being, the approach that we are taking is that we do not see the need to have a mandate for vaccines at this point, given the privileged position that we are in terms of the high rates of vaccination.
Thank you, Minister Phipps. I hope that put that matter to rest for now. Dr. Wilkinson, you have shared your vaccination status with the public. Several high-profile radio personalities and politicians have refused to disclose their vaccination status. Do you think they have a responsibility to the public to disclose their vaccination status, or is this private and confidential medical information?
Well, I'll start off by saying legally, one doesn't have to disclose their vaccination status to the public. However, if you're a public figure, if you're a politician, where persons are looking to you for leadership, I believe it is ethically problematic not to do so. I believe that if you are a leader and you know that the vaccines are safe and effective and that they can save lives, you have a moral responsibility and a duty to encourage persons to go forward and get vaccinated. And it will be deceitful for you to know that you are vaccinated and don't disclose that to the persons who are dependent upon you. Because a part of getting persons to be vaccinated is building public trust. And if you know that you have received a vaccine that can save your life and that can prevent you from being hospitalized and having severe disease, I believe that you have a moral responsibility and duty to let the persons who are dependent upon you know that you have been vaccinated so that you can build their trust, because people follow their leaders. I believe that if you're a politician and elections coming up, you don't go and tell persons you have a choice on the ballot and it is your choice, you can choose A or B. You clearly tell them that you need them to vote where you want them to vote. And so I believe any politician, any leader should send a clear and unambiguous message that the vaccines are safe and effective. It is time for us to stop playing politics with this virus. It is time for us to take this virus serious, because if we don't, more people are going to get infected and more people are going to die. And I believe it is time for us to unite. The time for politicking is over. And if the events over the last few weeks was not a wake-up call to the entire country, to the entire leadership of this country, that we need to come together and sing from the same hymn book and get persons out to be vaccinated, then I don't know what else to do.
Thank you, Dr. Wilkinson. You know, His Holiness Pope Francis has been one of the persons foremost speaking out against about the moral and ethical responsibility that people have to each other, to their communities, to take the vaccine. In fact, he has said that there's a relationship between faith and science. Faith is not opposed to science. Up to this morning, somebody said to me, they're not taking any vaccine because your protection is in God. If your protection is in God, that is okay, but taking the vaccine doesn't mean that your protection is not in God. Faith and science go hand in hand. It is God that gave people the knowledge, scientists the knowledge to be able to help in curing diseases and preventing diseases and all of that sort of a thing. So that sort of an argument, not even God will argue like that. This next question: should persons that had to quarantine 28 days because of whatever circumstance be given priority to get the PCR test results? And the next one is, when will the next SR&O be published? Because this one expires tomorrow, the 7th of October. Yeah.
In relation to the priority for the PCR testing, we have said that we've cleared the backlog and we are back on stream, and so everyone who needs to be tested should be tested in a timely manner. The new SROs, they're going to be coming out tomorrow, and so even for the person who asked about the reduction in quarantine, I'm pretty certain that when they come out tomorrow, we will all hear, so you can plan for December, okay? So all that would be contained in the new SROs.
This is our last question for today, but I think I can answer it. I was COVID positive, got clearance on the 28th of August, and have been COVID free. Can I take the vaccine at the end of October? Yes, based on what Dr. Wilkinson explained. You can take it tomorrow. I want to thank all of you for the questions that you asked. There were some really good questions that were posed today, some really meaningful questions, and I think that the answers to those questions were also very meaningful. So thank you. You know, your questions are a part of the management of the COVID-19 pandemic, and the answers that are provided here, we try our best from a scientific standpoint, from a legal standpoint, from a social standpoint, economic, and so on, to provide you with the answers that are needed to help you to manage in this time of the pandemic. So we thank you very much. I want to thank Superintendent Cromwell Henry for his presentation today. Our acting Chief Medical Officer, Dr. Cameron Wilkinson, who is filling in for Dr. Hazel Laws, who is on vacation. And Dr. Hazel Laws is not on official leave. I saw something saying that she's on official leave. Dr. Laws is on vacation to return. Official leave means something else and is meant to mislead people. It is meant to mislead. I want to thank Mr. Abdia Samuel, and I want to thank the Honorable Wendy Phipps and the Honorable Akila Byron Nisbet. And thank you very much for coming back to us, Mrs. Christmas Jacobs. We appreciate your service very much. We thank ZIZ for their service. We thank all here at NEMA and all who do work, the task force, and all who are working so hard to help us with the management of this pandemic. It is not easy. We know that the Ministry of Health does not have it easy, but we have to exercise some sort of a patience sometimes and realize that we are all in this together. We are all in it together. Sometimes we get frustrated, sometimes we get depressed. There are a lot of emotions that come about. But the truth of the matter is that we are all in it together, and we all have a part to play in reducing the transmission and a part to play in ending this pandemic. So that is the message from this platform. I want to thank you for joining us today for this press briefing. We will be back next week with another press briefing. Until then, take good care. I am Les Roy Williams.
Is on.